take these Substack lives as an opportunity to share some of the cases that are coming my way these days. Usually it usually becomes obvious some of the issues that are going on out in the collective by the cases that end up knocking on my doorstep. And there's a couple pretty big issues I wanted to cover today. Last weekend, I got a call from a client of mine who I hadn't heard from for goodness, must have been about 10 years now with COVID and everything. I took care of her Weimaraners for years. She had two gorgeous, beautiful, friendly, sweet Weimaraners, and both of them passed away from old age and, degenerative conditions. And she ended up adopting the Schnauzer. Well, she called me up in somewhat of a crisis. The Schnauzer had been healthy. She adopted him as an adult from an older gentleman, and he had gotten a Banfield plan for the dog, like a lifelong preventative wellness plan. Now, this client knew for me she didn't use a lot of vaccine. She didn't take the dog in really because the dog wasn't having any health issues. Now, the dog's about 9 years old, so she got a notice that he was due for a vaccine, and she said, "Well, maybe I should just take him in for a checkup." And she took him over, and she's been going through a lot of personal issues in her life right now, which a lot of us are. Her mother's sick and a lot of other things have been going on. And so somehow, as she told me, she allowed them to talk her into giving a 6-month heartworm preventative injection called ProHeart 6. Right after the dog received this injection, he ended up um, going through a whole series of symptoms. So he became super lethargic. Then he didn't want to eat. Then he showed up with like high white blood cells, but when they checked him out and everything, he didn't have a fever. There were some other and then got better. And then in another couple days, he ended up neurological. He ended up walking with what we call ataxia, which is like a stumbling, drunken gait on the back end. So she took him back in for that, and they couldn't really find anything wrong, but they kept telling her, "Oh, this isn't related to the Pro Heart. He probably jumped off the couch wrong and hurt his back. It can't be related to the Pro Heart. It can't be related to the Pro Heart." So she finally, after a week of further symptoms and all of these problems going on, she found her daughter looked at her and she looked, see, she got my number, called me. I went over there and I said, "Listen, the first thing I did is I played Google Doctor and took ProHeart 6 and I just put it into Google it to look up. I wanted to find a list of adverse effects. And of course, now in Google, we get the AI thing and the adverse effects. But actually, when I looked down the list of them from the study that it came from, um, it was following the list of every single symptoms her dog had shown over the past 7 days. Like one symptom would flare up and it would kind of go away, not quite, and then another symptom would come up, it would kind of go away, not quite, and then another symptom would come up. So after she told me the history, then I read out this list of symptoms and said, "Wow," because it literally matched up almost exactly. So, what is ProHeart 6? Now, they have ProHeart 6 and they also have ProHeart 12 put out by one of my not so favorite drug companies. Um, ProHeart 6 is an injectable moxidectin. And what they did is they took the moxidectin, which is a heartworm preventative, and put it on these little like spherules. I'm not sure what they are. And then what they do is they take a whole 6 months worth, or now or a whole 12 months worth of that medication and deposit it under the skin of your dog. So the idea is it slowly leaches out over the 6 month or over the 12 months so that it keeps heartworms at bay. Now, It sounds like a good idea at first, but when you think about it, you're taking a whole entire 12-month worth of drug and putting it inside the animal, hoping that it leaches out at a consistent rate and hoping that that deposit of that 6 or 12 months worth of drug is not going to cause any problems. I mean, I worry about just the localized problems of where they put these injections. Now, the history, what I want you guys to really look at is there's a history of medications and a history of pharmaceuticals. And a lot of these things have been released before or in a different form, or they may have been tested in humans and it didn't work so well in humans. So then they put them over to the veterinary world. Now, so the history can tell us a lot about some of these medications. And COVID should have taught us, many of us, a lot. It's for some people it did, for some people they're still blocked on the whole idea. But sometimes you can go back and you can repurpose medications but the drug companies don't like to do that because when medications, their patents only last so long. And when that patent runs out, that means that other drug companies can make a generic version of that drug, and the drug company that initially released it loses all their mega profits they've been making on it. Okay. So that's just one thing. So looking at the history of drugs, it's actually pretty fascinating and it gives you a lot of information. The history of ProHeart. ProHeart was initially released by a company called Fort Dodge, who did a lot of vaccines over the years. I think they got just sucked up into another company. It was back in, I believe, 2003, because it was taken off the veterinary market in 2004. Now, I remember I was just starting my house call practice. I started my house call practice in 2001. So 2003, ProHeart was released, and anytime a brand new fancy schmancy, oh, it doesn't have side effects, oh, this is the most wonderful thing in the world, that's the time to just take about 10 steps backwards and say, let's find out what's going to be going on with this medication or drug. So I would not use anything that would I just don't even use anything until it's been on the market for a couple of years. Um, so it wasn't called ProHeart at the time. I forget what it was called. So people started injecting dogs with this. At the time, I think it was a 6-month product. And within a year's time, now again, this was 20 years ago, different time, different place. Within a year's time, dogs started showing up with severe autoimmune reactions from this injection. So we're talking about autoimmune hemolytic anemia and autoimmune thrombocytopenia specifically. Now, these autoimmune conditions, autoimmune hemolytic anemia means the immune system starts attacking its own red blood cells, and it can do so to impact to the point that the dog becomes so anemic, they start having other reactions and they end up dying from it. Okay. Sometimes you cannot get it stopped. And oftentimes, once a dog has autoimmune hemolytic anemia, they are just never the same after that. Now, there's also autoimmune thrombocytopenia, and that's where the immune system starts attacking its own platelets. Platelets in the blood help the blood clot. So if you don't have clotting ability, you can end up having internal bleeding. The dog can literally bleed out. So dogs were dying from this injection, and being that it was 20 years ago, that, maybe the FDA functioned a tiny bit better than it does now, the FDA pulled it off the market. Within I think it was only out for like a year, maybe a year and a half. It wasn't out that long. So they pull it off the market and they set it aside in the vaults. Well, guess what happens 20 years later? A drug company comes along and they start digging through the vaults and they're like, oh, look at this drug. We could get this back on the market, and FDA now will pass it. So sure enough, they pull ProHeart out of the vaults and they rebrand it, they rename it, and they put it on the market. Um, And yes, this is actually happening. And not only do they put a 6-month variety on the market, they label one for 12 months. It's like, let's just do double. I don't know what the difference is between the two, but it's almost like let's just do double the amount you inject under the skin and call it ProHeart 12 and we can charge double the money for it. And we can get these corporations right now at this time, like Banfield, like some of these other corporations to market it and buy it and make money. So that's how that goes. So I would really not recommend getting any kind of injectable heartworm medication. Now, that being said, I've had the way social media runs our world right now, and that's a whole nother topic we could discuss. I've had multiple clients sending me this TikTok. I'm not on TikTok. I'm not going on TikTok. They sent me this TikTok blip about the $10 billion heartworm scam. All right, guys. I like to find the middle of the road between these things. Yes, ProHeart is bad. I would not use it. But guess what? There are heartworms. I don't subscribe to the new German medicine that say that viruses don't exist, bacteria don't exist, worms don't exist. I have opened dogs up. I have seen hearts filled with spaghetti worms. They literally look like spaghetti. These are not little microscopic worms in the bloodstream. These are strands of spaghetti in the bloodstream, and they can be so bad that they literally clog up the heart. And if you see a heart with one of these, you can probably find a picture on the internet somewhere. I have actually seen them. I have seen heartworms have been found on ultrasounds of the heart, flopping around inside the pulmonary artery and inside those vessels. So heartworms are a real thing. They have spread around this country. A lot of it, I think, is through mosquitoes. A lot of it is through changing climate, which we always have changing climate, and people moving around. When I grew up in Colorado in the 1970s and 80s, I had not even heard of heartworm. I didn't hear of heartworm until I got to actually, when I was working in the shelters in the 1990s, we heard about some of it, and then when I got out to Wisconsin to vet school, that's when I really heard about heartworm. Um, the oldest heartworm preventative that has been on the market forever, I think it was the first one they released, has a microdose, not a full dose, a microdose of ivermectin in it. Okay, it's HeartGuard. Now they came out with HeartGuard Plus. The Plus has a very small amount of a pretty gentle dewormer called pyrantyl pamoate that kills roundworms and hookworms. Okay, it's not that big of a deal. So if you live in a heartworm endemic area, which I happen to, we have mosquitoes year round. It never gets cold enough for the mosquitoes to die. It never gets cold enough for the heartworms to die inside the mosquitoes, which is how they're transmitted. I would really recommend using the HeartGuard for your dogs and cats. I have somebody in my private online group, and if you're ever interested in learning about Chinese medicine and really kind of taking a deep dive into Chinese medicine and energetic medicine, you could join me. But I have a student in there who has been, she knows a lot about her dog. She's been really dived into dog care. Her dog was diagnosed with heartworm last year and had to go through the treatment. There was, and I can actually pinpoint the person from Dogs Nationally magazine, came out with this whole anti-heartworm preventative thing. Well, guess what? They live in Canada. They don't really have that many months of the year where heartworm is really a problem. I live in South Florida. It's a major problem here all year round. My dog, who recently died 2 months ago, Molly, I had her for 15 years. She came to me after being treated with heartworm. So we see a lot of it here, and giving a microdose of ivermectin is not going to kill your dog. The dogs that are sensitive to it are herding dogs, are Australian Shepherds, are dogs with a specific gene that allows their blood-brain barrier to be a little bit more leaky than natural. But even the low dose of ivermectin, it really takes more ivermectin to create a problem, and now people are out there reaching for high dose ivermectin, wanting to treat their dogs with cancer with it. So again, middle road, middle path. Let's be reasonable. Let's really look at what we're doing. Let's not fly off the handle on some other kick that all of it is bad and it's all poisoning your dog. I can think of a lot more things poisoning your dog than a dose of Heartgard, like walking down a city sidewalk that's just been sprayed with Roundup to get rid of all the little grass growing out of the cracks. That's doing more damage to your dog than a single dose of heartworm. Okay. So that's my pro heart thing. Just don't. It goes back to my standard rule. If you go take your animal into a veterinarian and they want to inject them with something, hold off. Say, if you're not sure what it is, there are a couple good injectables that may really help, but there's a lot of others that don't. And why I'm saying injectables is once you inject something into the vein under the skin, you cannot take it out. It's in there. So this little schnauzer I'm treating, we're going to be dealing with this for the next 6 months. Hopefully, more symptoms do not come up. I've got him on a detox program. We're trying to do things to support his liver and kidney and all the things that are involved. But it's a pretty serious situation with him. Okay. So if you go into your vet and they want to give them an injection, just say, let's wait. I need to get a couple other opinions. I want to check it out first. Or, I don't have enough money today. Let me come back tomorrow. Step out of the vet clinic, do some research, even, look it up on Google, look up some veterinary sites, do some research on the side effects, and then decide, or call another couple vets. Or if you want to call me, you can call me. I do short consults. Okay. So there's my story with the injectables. Second thing I wanted to talk about, and this is from a case that I've been dealing with over the past few months, is using ChatGPT to diagnose, treat, or even research things for your animal. Even though I just said, Google this or that, you have to be discerning and you cannot take everything it says with a just blank slate. Oh, this is what is going on. I'm going to tell you a story about a gentleman, and I'm going to I'm going to mix and match several cases together here. So it's not exactly this one case because I'm keeping things, I'm not giving names or anything else. So, this gentleman had a dog who he really, really, really loves. Okay. We really love our dogs. And the dog has had a partial tear of a cruciate and been limping on and off on one of its hind legs. And he knows, more than likely the dog is probably going to need surgery at some point in time, although the dog is just doing fine without it. But she doesn't feel confident going out to the dog walk. She doesn't run and play like she used to, although she is getting older. So what he wanted to do is go around and talk to surgeons and get everything lined up in case the ligament completely tears and he's in a situation where the dog has to have surgery right away. So he was going veterinary clinic to veterinary clinic with the dog to talk to surgeons. Well, what inevitably happens almost when you go to too many veterinary clinics or hospitals or doctors' offices is the dog ended up picking up a case of kennel cough. Now, kennel cough in dogs is like the common cold in humans. It's actually spread by a bacteria, Bordetella bronchoseptica, and two different viruses. And the bacteria and the two viruses start having a party in the trachea, in the upper airways. And a lot of times you can tell your dog has kennel cough by just they'll have this hacking cough. Sometimes a cough is so severe that it's like they have something caught in their throat and they're literally trying to vomit it up. And sometimes they will spit up some phlegm or some mucus. Usually it's just clear, frothy mucus coming out of their throat. But it's just like us if we have bronchitis or something where you cough and cough and cough, and then you bring up just kind of phlegm. Um, so if you a dog with really severe kennel cough, if you find they're not right, right on their sternum and the sternal notch. And if you press right in there, what you're going to hit is the trachea. And if you press a little bit hard, if it's not a small dog with tracheal collapse, because they'll also cough, you can provoke a cough. And that's one of the tests that I use. So this was a large dog, a Doberman. He was coughing. He was keeping him up at night. He cares about this dog a lot, and he was already worked up and scared that, something was happening with her. So he's like, "Oh my gosh, my dog's coughing." So he goes into a regular clinic, and instead of the regular clinic telling him, "Well, listen, it's going to be self-limiting. We can wait and see, put the dog on some vitamin C, put the dog on some things to help its immune system, maybe do some coupage, like cupping, put it in a bathroom with some hot steam to help break things up. There's some Chinese herbs that are good to help, or even sometimes I'll use like Mucinex just to break up the mucus and help them along." Well, they put him on antibiotics. So took him home, doxycycline for a month. Took the dog home, the antibiotics didn't do much, so then he really started worrying because he's like, "Oh, no, now the antibiotics aren't working." So he goes on ChatGPT, and of course, depending upon how you ask your question on ChatGPT, ChatGPT is going to tell you your either greatest fears or exactly what you wanna hear instead of what's really going on. So then it came up, well, it could be pneumonia, it could be this, it could be that, it could be an antibiotic-resistant infection. Oh my goodness, on and on and on. So we went back to the vet. He's like, "My dog could be dying." He was very concerned. Of course, then the vet gets concerned because it's like, "Oh my gosh, is he going to blame me?" So they switch antibiotics and put him on another antibiotic, one that actually happens to potentially cause more problems with ligaments, the fluoxetine, which can have problems with connective tissues in the body. So he goes on that antibiotic, and then I go over to see him for his acupuncture treatment, and I'm like, okay, within all of a sudden, the dog has been on a full month of antibiotics. Now he's on a second round of antibiotics, and I tell him, I said, "Listen, it can take a good 10 weeks for this cough to resolve, whether you use antibiotics or not use antibiotics. But what you're doing right now is you are killing off this dog's microbiome. You're killing off all of his gut bacteria. 70% of your immune system resides in your microbiome. So you are by trying to stop the cough with antibiotics, you are actually potentially weakening his immune system and drawing the disease out for a longer period of time." Well, then he got on this whole kick with ChatGPT saying, "Well, why don't we culture the mucus coming out of his nose and culture the nose swabs?" Now, you will rarely see anyone do a nose swab culture for something like this because just think about it, and I didn't even think about this with the COVID test, but think about it. If our nose is breathing air in externally in through the nose, and in our nose are all these little hairs called cilia that are meant to trap pollutants, trap particles, trap bacteria and viruses from getting further deeper into our body and deeper into our airways. There's also a lining. The lining in our nose is part of our immune system, and it has a lot of immunoglobulin A in there, which actually grabs a hold of things and keeps infectious agents from getting deeper into the body. So if you're going to find some bacteria, it could be really common to find it in the nose. So he talks the vet into swabbing the nose and culturing the nose. So of course, when they swab the nose and culture the nose, they found an antibiotic resistant bacteria. So then they wanted to, according to the culture results, put the dog on a really, really strong antibiotic that potentially had nephrotoxic effects. That means it could potentially be toxic to the kidneys. Now, we're already talking a 9-year-old dog who's already been on 6 weeks of antibiotics, and then they want to throw something on board that's gonna knock out kidney function. So I found that out, and I literally put my fist down. I said, "Listen, no, do not do this to your dog. I don't wanna stand by and watch you kill this dog with all these antibiotics." So what they did instead, they put the dog on a double dose of the floxacin for another full 2 weeks. And all of this came about because a lot of it was his chat GPT and his fear. He's going into this vet, freaking out at the vet worrying, oh my gosh, is it going to come back on me? Okay, let's culture it. Oh, look at this. Now we need to do this and now we need to do that. So, what happened after, as he was finishing up the 2 weeks of double the dose of the floxacin antibiotic? The dog blew with watery liquid diarrhea. Now this was actually the dog stopped eating and having appetite problems before he even doubled the dose of the antibiotic. So I kept telling him, I said, you are killing this dog's gut microbiome, and there are going to be ramifications for years from here on out. The dog had been on a really good, actually raw diet before we started all of this. So he got to the point where his dog wouldn't eat at all. He was trying to hand feed. The dog would only eat treats, got totally thrown off his food. Um, and then the dog developed really liquidy diarrhea. So now, not only, and then about 10 weeks from the time that the dog initially contracted the kennel cough, the dog's kennel cough resolved. Thank goodness that the dog had been on a good diet before starting all this, but we are now dealing with chronic, probably IBD issues, and he still needs to go into surgery and get his knee fixed. So at this point in time, we're trying to rebuild him from all the damage done to try to get his immune system healthy enough so he can go into surgery and he can actually come out of the surgery well and happy and healthy. So this is just one example of how ChatGPT can lead you down a really, really crazy path. Now, ChatGPT is not, number one, is not a human being. They are not using their five senses to look at your dog and see what is in front of your dog. If you want to play cookbook medicine and, just plug and play, like plug your dog into a computer, which I really don't recommend. I don't recommend plugging anything into a computer to having the computer diagnose it. There's just too many nuances, guys. And when you go on there and you get things fixated in your head, and then you go into these veterinarians these days are having a harder time diagnosing anything to begin with. So when you lead them down another path, then you could be going down a path that could ultimately kill your dog for a thing so basic as kennel cough that is self-limiting, and the dog will recover on its own. It's like somebody recovering from a cold. And then they turned it into this big giant balloon. So please, 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 um, if you find yourself being sucked down that rabbit hole, just unplug the computer, put down the phone, step back and step away, and go and get some second opinions. I'm actually revising my strategies as a clinician, and my offerings that I'm going to be offering pet parents, so that I can be more available for holding your hand, guiding people through these decisions, guiding people through the decisions when they walk into a veterinary clinic. I had another case having to do with it was an acute care case with a dog with an abscess. The client was one of my clients from Florida. He was vacationing up north. His dog ended up with an abscess, a 6-month-old puppy with an abscess on his neck. And he went to 2 different clinics, and they couldn't just treat the abscess. Like, if you to treat an abscess is pretty a simple procedure of lancing the abscess, creating a hole to drain the pus out. They already knew it was filled with pus. Drain the pus out. In this case, I would use some antibiotics. I would flush it out really good, but 2 clinics up north he went to couldn't figure out how to do that or didn't have the capability to do that. So he ended up having to get on an airplane and fly all the way back down to Florida. But by the time he got here, the abscess has gotten so big and the pus had spread underneath the skin so far, he did have to go to a specialist. But the specialist ended up treating that severe abscess the same way that I was on the phone to these vets recommending they treat the small abscess, which is lance it, flush it out, put a drain in for a few days, and put the dog on a course of antibiotics after culture and sensitivity comes back. Um, so yeah, so we have another vet friend on here. Nice to see you. So just beware of ChatGPT. Beware of anything injectable going into your dog until you discover what it is, until you do some research. I like to go to the actually FDA approval section. I like to go to read the box, read the package insert. You know, a lot of times people are like, "Oh, yeah, a few dogs got diarrhea and vomiting from the product on the package insert, but it's no big deal." Really read the package insert. I on my Substack, way down at the bottom, one of the earliest articles I put out there, I go through an example of reading the package insert from a product called Librela and the red flags that popped up at me in that package insert and why I would never inject one of my patients or one of my own dogs with Librela. So you can go back and read that. I actually cut and paste the actual paragraphs of the package insert, and then I give my interpretation of that in italics and what that says. So we have to educate ourselves. We have to be, we owe it to the animals that we love to be their advocates and not just give away our power. And unfortunately, these corporations have stepped in and taken over veterinary medicine. I feel really sad for the new graduates coming out because they're not learning a lot of the basics that I learned when I was in school. Um, and so that's part of why I'm expanding to doing a lot of coaching, case management, helping people manage cases when their dogs come down with cancer and they're trying to put together a team to help treat it and what their options are out there, and providing integrative options for a lot of these treatments, and also providing seasonal wellness plans based upon traditional Chinese veterinary medicine so we can keep that animal as healthy as possible. So when something like this does happen, they can bounce back from it faster. Like this Doberman with all these antibiotics, the fact that the dog had been on raw food is probably what is keeping that dog from not having more severe symptoms at this point in time. So if you're interested in that, continue to follow me. And if you have a bunch of animals, I'll be coming out with my new offerings soon. Oh, Mickey Lewis is here. Hey, Mickey. Um, She's, she's been a client of mine for a very long time. She makes her own dog food in her kitchen, and I have a video up. I'll share that on Substack. I have it on YouTube, but I don't really have an official YouTube channel, but I'll share the video on Substack because I went to her house. She's like the Betty Crocker of dog food, and she's fed her dogs raw food from the time I first walked into her house. She was sending her Goldens out on the back porch with raw chicken backs to chew on it as their afternoon treat. So thanks, Mickey. Nice to see you. Um, yeah, and I know Becky was on here too. I'm actually helping her with one of her dogs. So that's what I have to say today. It's been a long week. We're coming off of a big full moon in Aries, a big fiery full moon, a lot of changes, a lot of shifts going on. I think one of the things to do is to step away from the screens, step away from the news, get your feet on the ground, go outside and take a walk with your dog. It's been really rainy here, but I'm still going to go outside and try to take a walk with Buddy today just to get out and get some fresh air, even if we do get wet. Um, and you know, I'm just be really careful what you give your dog at clinics or how you're managing their cases. And if you do get them on a good seasonal preventative wellness plan, you can actually avoid a lot of these problems. But dogs have things happen to them. It's just like having an abscess or having a torn cruciate ligament or having a small tumor. All of these things happen, and sometimes you have to go through the veterinary medical system to help get them fixed and taken care of. But I can be there for you and hold your hand through it to help make better decisions and not be pushed into giving a lot of things that are unnecessary. So thank you. I follow me here on Substack. You can follow me on Facebook. You can follow me on Instagram, although most of my writing and articles and everything's here. And I should be on here next Saturday for another live. So take care, you guys. Have a good weekend. If you have any questions, I could hang on for a few minutes if you have any questions and want to put them in the messages or not. Or you can, if you have questions for me, go ahead and add them onto the post and I'll answer them later on. Um, let's see. Mickey, Mickey sent me a text message. Anyways, take good care of your animals, give your dogs and give your cats a big hug. They don't live forever. We don't live forever. Appreciate every single moment you have with them. Okay. Take care, and we'll see you next Saturday. Bye bye.